I'm here in Sydney, Australia. So today we are going to discuss basically the opportunities as a medical doctor, how you can migrate to Australia, what are the steps you need to take. And basically, this is very short presentation and more to like one-on-one with me. So if you have any questions related to exam or job or visa or anything, anything you can ask me.
Sir,
So
I
hi,
want to ask.
yes.
Yes.
Yes, 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 sir. We can start.
Okay. Guys, you can ask the question at the end of this webinar. One-on-one, you can type your question in the chat box, or you can just unmute yourself and ask as many questions you want. Okay. So this is a very short presentation. Okay. That hardly 15 minutes will take, and then we will talk to you one-on-one. Okay. So, and personally, I am making content last 5 years for medical professionals to migrate to Australia. So you can watch my videos on YouTube. So there's a lot of basically, in my personal life, basically I'm here. It may take around for me 8 to 10 years because I do not know the process to migrate to Australia is very, very easy and very simple forward. Just need to pass the exam and come to Australia. So I do not know when I was in India. So I'm basically then I find out the issue. This is very easy, and then I start making the videos. Okay? So now we are at Academically. We are providing the all the support to for you to migrate to Australia. It is not just the exam. We'll help you in the documentation, exam, and then the job and visa, whatever we can. So this is we are providing the assistance for all healthcare professionals like medical doctors, dentists, pharmacists, nurses, physiotherapists, optometrists, veterinary doctors. So any healthcare professional looking to migrate to Australia, so we can help them. So this is about myself. So I completed my PhD from University of Sydney, from Faculty of Medicine and Health. I'm basically Indian pharmacist. So I completed my diploma in pharmacy, bachelor of pharmacy, doctor of pharmacy from India, and PhD from Australia. And I have around 10 years of teaching experience in. I work around 4 months in India. Then I moved to Malaysia where I work around 4 years. And last 6 years I'm living and working in Australia. This is very brief intro about me. So they are the faculty for this course. We have Dr. Swipnil Sharma. She's from basically Indian. So she completed her MBBS MD from Pune Medical College, and she passed this AMC of 1 and 2. Now she's practicing in Sydney, and she's one of our course coordinator for this program. Another one is have Dr. Udara. She's also MBBS MD. She basically from China. She did, but she from a Sri Lankan background. So she also gone through the same process. Now she's working here in Sydney. And we also have another Dr. Amanullah. So these are the three faculties for this program. We have some other faculties for this AMC. So why Australia? What are the opportunities for you as a medical doctor? So Australia provide 190,000 PR visa, permanent visa. So permanently you can live and work in Australia once you complete this process. And there is a article from AMA, Australian Medical Association. Basically, they published recently one article. November, basically you can see here, November 2022. They are projecting basically the shortage of GP, 10,000 plus. And if you go basically on any website, for example, c.com, you will find a lot of jobs vacancies are available, especially in the regional areas. Okay. So what is the salary as a GP? I'm not talking about the specialist, it is just a GP, like physician, how much they can earn up to 400K per year. This is just on average, basically the salary GP can earn up in Australia. So it's equivalent to around 2 CR in Indian rupees, if we can see per year as a doctor you can make. So in your mind might be, what is the salary, how they calculate basically, so how much as a doctor they can earn, So in simple words, basically, when you pass this AMC part one, even your work in Australia as a GMO, junior medical officer, or resident medical officer, the salary will be around 80 to 120K yearly. And then simultaneously, you can prepare yourself for AMC2 or WBA program. You can go. I will explain in my next slides for this. But a salary calculation, very, very simple here. So, as you know, here is the Australia government funded system. So, as a patient, you do not need to pay anything to a doctor or pharmacy or laboratory or any other radiology or I mean, any test. Okay. So, as a GP, as a doctor, minimum $21 you will get, or maximum you will get $250. This is based on uh, kind of procedure you are performing. Based on that, you have to charge per patient. And on an average per day, how many patients you can see? So this is the Australian regulation. Maximum 60 patients you can see. Okay, but on an average, I know many GPs here in Australia. I personally, I talk to them. So they're saying they see around 40 patients very, very easily. 40 to 50. But I calculate here. If we calculate like um, I'm just calculating for 5 days weekly, you have Monday to Friday. Okay. So if you see, like, if you are seeing at least 40 patients per day, and we calculate like $30 per patient you are getting, you can earn 12,000, 1,200 AUD per day. And it's going to be around, 12 to 13 lakh. This is the minimum calculation I. Okay, and you can earn basically a lot of this based on this calculation. So minimum you will charge $21, maximum $250 per patient, and maximum patients you can see per day 60 patients. And while you are working in government job or something, Monday to Friday they will give you the normal price, the salary. But if you are working Saturday, then you will get 1.5x salary. Okay, and if you are working on Sunday or public holidays, you will get a 2x salary. So many I know, some of the doctors from Desi guys. So they work basically Saturday, Sunday purposefully, and they take leave, like any other normal days to earn the more money. This is also very, very common here. So apart from this, the financial part, there are some other important parameters why you need to migrate to Australia. The education for kids up to 12th is free in Australia. So you no need to worry anything about the school fees and all those things. And healthcare also access free in Australia. If anything happened to you or your family, you don't need to worry. Everything is free here in Australia. And then professional development. For example, you are a GP and is there a new technology or new something, you want to attend any workshop, or you want to attend any CME, or you want to go for any conference, so most likely the hospital pay all these bills, and they encourage people to go, to actually operate in your own field. Work-life balance, as I mentioned, in general, you need to work 38 to 40 hours weekly. So basically 8 hours, basically you have to work 8 hours per day for 5 days in general. And career opportunities a lot. There's a high demand for healthcare professionals. They are getting the fast track PR visa for healthcare professionals. And quality of life obviously is very high if compared to our own countries. And here, more than 140 countries people are migrating to Australia. A lot of people, you can see doctors, they are working on Australia. They are basically trained in US, UK, European countries, Brazil. You can find a lot of doctors from those countries. Last few years, nowadays, from our countries, yeah, people are migrating. Earlier was not that much money. And of course, very high earning potential, the doctor in Australia. So steps towards your dream. So these are some steps you need to complete, and Academically is here to help you to complete all these process. So first step, basically, in very simple word, I can say you just a document verification part. Okay, we will help you to complete. No need to worry. So basically, this is also consist of two parts: epic verification, then AMC portfolio. This is very simple. We will help you. No need to worry about this. And this much fees you need to pay. And then we will provide you the coaching for this AMC part one. So this is the step two. Step one, document verification, and it may take around 15 days or 2 weeks. Okay, around 2 weeks, you can complete this step one. Then step two will provide you the coaching for around 4 months to complete the syllabus, including the mock test or revision. Okay. So we'll provide you coaching for. We provide basically live session, live classes from Australia. As I mentioned, our faculty is in Australia. So you can access these classes on your laptop, desktop, or you have tablet, whatever you have, mobile phone. Okay. So we have our mobile application, Android and iOS, or wherever you can access very easily all the classes. And these 4 months are more than enough to give for this exam, or we can say, no, you can easily, you can practice it there. Sorry. And then uh, you have to go for English test, in-person test like IELTS, OET or PT. But I personally recommend for you to go for that OET or PT. These are the easier exam as compared to IELTS or TOEFL. TOEFL is not acceptable in Australia anymore for the visa purpose. So please go for this PT or OET. Okay, I don't go TOEFL, but you can go IELTS if you think that you are more comfortable with IELTS. So you can go for IELTS as well. And once you completed these three process, you can complete this process from your home country, and you're eligible to apply jobs in Australia as a JMO or RMO. Okay, so you can apply these jobs. Junior medical officer or resident medical officers, you can work, and you can get salary up to 100,000. And simultaneously, you can prepare for AMC Part 2 or WBA program. So many doctors are afraid because AMC Part 2 is passing rate is not very great. Part 1 around up to 70% the passing rate. Okay, Part 1, AMC Part 1. But Part 2 around 20 to 25%. Okay, as a student pass this in the first attempt. So is there any alternate? The student always ask me this question. So there is an alternate basically called WBA, work-based assessment. So there is a 19 hospitals. The AMC basically, we can say they give the approval for them. They can conduct this W program. So you can, once you pass AMC Part 1 plus English, then you can start applying job those 19 hospitals. And once you got that, then definitely very easy for you to go for WBA program. And WBA program is passing around, I can say 99% possibility for you to pass. I don't see anyone is fail in that exam unless you did very कुछ बड़ा आपने कुछ जो ब्लेंडर कर दिया हॉस्पिटल के अंदर might be in that case might be fail. Otherwise 99% you will pass in the WBA program. So it's very easy for you to. And once you complete this program, WBA you can complete like 6 to 8 months, but in general the hospital will not let go for before 1 year. So they want to be for you to work at least 1 year to complete this WBA program. And once you done it, and then you will get a general registration or full registration. So this is the process. And then even if you got this job, you are working, you are eligible to apply for the PR visa like 491, 190 or 189 or the other PR visa. So this is like work-based assessment. This is basically government Western Australia. So they are mentioning here. So they are just, what are the requirement they are asking? They are asking just to pass, and you have to apply the job. So they are just asking basically, this AMC exam, you pass part 1, and that's it. They are asking, nothing else they are asking apart from this. So once you pass AMC part 1, we will help you to pass this exam, and then you can start looking a job in Australia. These are some of the websites, I think, the links how you can find a job in as a maybe I can show you one or two advertisements. These are basically government advertisement. So you will find basically a lot of jobs in Australia in private sectors also, but I'm talking about the government jobs. So this is like a government, this is junior doctor training program. Are you able to see my screen, guys? Okay, so junior medical officer training program, and then you can apply from here. And there is separate fund for this. There are so many hospitals basically they are hiring. So these are the government, basically agencies. They are hiring. For example, Canberra Health Services. This is the state government. Canberra is the capital in Australia. So they are hiring, and then New South Wales they are hiring, and Victoria. So there are so many, Queensland here and there, Western Australia, Tasmania. So you can find here and you can apply from here once you pass this AMC Part One. Okay, and you can read more here, and our team will give you the all these links. So no need to worry if you need all those things. So AMC exam basically conducted 10 times yearly, except December or January. Any times you can give whenever you are ready. Okay. So for example, for PLAB, UK, you need to book your exam at least 15 months to 18 months in advance. Otherwise, you will not got the seat. Or maybe someone is cancelled, you have to wait, someone is cancelled that exam, then you might get the seat. Okay. Very difficult for that play exam to getting a even to give the exam. And here, whenever you are ready, you can just write the exam, pass the exam, you start looking a job and come to Australia. So English proficiency test basically required for APRA registration. So overall, we need 7 individual band in IELTS or OET in B or 65 in PD. These are the degree, the assessment for required here, the basically documents like your degree, transcript, work experience if you have any, valid passport, government ID proof, or photograph, and medical registration are required. Okay, so there are 150 questions they ask in general 3 hours time, around 50%. They will ask basically the passing marks required, and no negative marking for this. And the other PR visa, you are eligible to apply 190, 186, and 189. And there are some work visa also. And 491 is a regional sponsored visa, you are eligible to apply. Here are some of the media coverage about Academy. Recently published, they published one article in the Hindustan Times regarding us. You can see here, and this is, I think, News Nation. This was, and this is the SPS in Australia. So here the fees, our team will give you the more information, and we provide basically the loan facilities. So you can pay the fees in 3 months, 6 months, 9 months, 12 months without paying any interest rate. With Edu1's loan, we can help you if someone has financial issues. Here are some of the reviews from our students. So yeah, now I can talk to you one-on-one. Now please, doctor, please unmute anyone and can ask the question. Yes.
Hello. Hello, sir.
Yes, please ask.
Yeah, my name is Gnanasai Reddy.
Okay.
I just wanted to ask one question was, right now I'm a IMG from Belize, Central America.
Hmm.
So my college is right now recognized in ECFMG.
Hmm.
So I am planning to give AMC Part 1.
Hmm.
So now I have already done part registration of ECFMG.
Hmm.
And now I'm trying for Australia, so I'm going to do EPIC also. So I am planning to write examination in next year
Hmm.
after 4 months of preparation.
Hmm.
So during the examination, do they check whether my college have ECFMG or not? Like, because now it have, maybe next year it might have or it might not have. We don't know.
No, they will
So
just
that
check
is
once. They will just check once, and
okay.
it is very straightforward. It might take maybe 1 week, complete the process. And once they're done, then no need to do second time. If they remove later on, then no
Yeah.
need to worry for you.
Okay, sir. And second thing is, sir, like for getting AMC Part 1, I don't have license from here because As IMG, we don't get license in the place where I'm studying.
Actually, license is not required to sit in this exam. So many Indian graduate, they are basically graduate from Russia, China, Philippines, or here and there, like you, for example. So they are not yet registered RMP in the home country. Still you can sit in this exam.
Okay.
As I mentioned, one of our faculty itself is from China.
Okay.
Yeah, she did the same thing.
Okay, sir. And I wanted to ask one more thing. Now I have completed recently graduated in September. So maybe you think I'll give examination in next year, probably around March or April, after 4 months.
I mean, you can give this exam in February straight away. Basically, you need to study 4 hours at least per day for four
Okay.
months.
Okay.
You can crack this exam. This exam, I can. Are you Indian citizen?
Yeah, I'm an Indian citizen, but my degree is from Belize, Central America.
I understood. समझ गया मैं. I mean, I'm saying like NEET PG in India. This is easier than that NEET PG. I'm just comparing.
Okay.
Yeah.
Okay.
Okay.
Yes, sir.
Yes,
And
sir.
Sir, now can I ask a question, sir?
Yes. Yes. Please, one by one. Yes, Dr. Hitesh.
Hello. Sir, good evening. Sir, I would like to know that I finished my MBBS and my MS Orthopedics from India around 6 years back, and I am working in Delhi. I need to ask if I want to practice in Australia, do I need to write both the exams again, AMC?
Yes. So basically, in Australia, if anyone want to practice, there's a two route. One is called standard pathway, another one is specialist pathway. Okay. So I was talking about this standard pathway. You need to go for AMC part one and part two. So another pathway called this specialist pathway. Those completed master degree. For example, you did MS. Okay. और
हाँ जी, कर
MD.
लिए.
या तो उसके बाद आप लोग स्पेंड पाथवे पे जा सकते हो. पर होता क्या, दिस इज वेरी वेरी कॉम्पिटिटिव. But since you have 6 year experience, so my advice, just try, give once. And if you are not getting that, then you have to come, to us. We can help you in AMC part one, part two.
सर,
So
बट फिर इसमें सारा MBBS का दोबारा सारा पढ़ना पड़ेगा.
yes, स्पेशलिस्ट पाथवे में एग्जाम नहीं देना पड़ेगा. ठीक है, डायरेक्टली हो सकता है आपको 6 year का experience है. This is based on basically your CV and or your credentials. You might get that. But in general, they give preference. Those have like 8 years or 10 years experience. They are like in very good in research and all those things. They only got. Even our own faculty, Dr. Sipnu Sharma, she worked around assistant professor in India around 2 to 3 years, and she gave this exam after MD and this AMC.
अच्छा, नहीं तो अब AMC में आप कह रहे हो मैंडेटरी नहीं है, लेकिन हम सब अगर हम स्पेशलिस्ट के उसमें
आप
जाए.
समझ बात सुनो कि स्पेशलिस्ट पाथवे को आप एलिजिबल हो अप्लाई करने के लिए, मगर अभी तक जो प्रैक्टिकली उन लोगों को मिल रहा है जिनको 10 year प्लस के जिनको एक्सपीरियंस है. तो मैं बोल रहा हूँ आप स्पेशलिस्ट पाथवे को आप ट्राई कर लो. ठीक है, और
ठीक है.
साथ में आप AMC को भी प्रिपेयर करते रहो.
ठीक है सर,
Hello.
थैंक यू.
ओके.
Hello, sir.
यस.
Hello. Hello,
यस
sir.
प्लीज. यस कुमार प्लीज.
Sir, I wanted to tell that I passed MBBS in 2006, completed internship in 2006, and I did DNB radiation oncology in 2013. But I couldn't pass the final examination, and I did senior residency also in radiation oncology, and then I continued working in medical oncology. So overall, after since 2013, I have almost 10 years of experience, but I have not cleared the final DNB. Okay, so what are my chances to go through specialist pathway?
You can give it try. Basically, yeah, specialist pathway based on the other parameters, not just the degree. For example, you did some research and you publish and you guide some, you maybe some student did under your guidance, and research thing, or you did some presentation or something you did in your, in your life,
I did
something.
my thesis. I completed my thesis, which was accepted by National Board of Examinations.
This is everyone doing in India. That's nothing like in special. But I can say if you publish some paper, for example, in PubMed Index General, that will give you the
Okay.
edge because you are competing with government. A lot of doctors are migrating from UK and Europe and from US to Australia. So, in that case, but you
Okay.
can give it a try. I can say you can give it a try if you have 10-year experience, so you might have chance.
And what are the expenses from specialist pathway?
Is not much. I mean, you just go to AMC website and follow the path. There is no need to be have any exam and those things. So we are not basically help in that, because we are a education company. We are providing the coaching for AMC. Okay. So usko
Okay, sir.
directly you can go to your website and try to apply from there.
And if I want to write AMC and all, then my chances will be equal to the fresh candidates or lesser.
No. Then you will 100% you have a chance. You and doctor, I think, uh, I don't know where he just left. I think you guys have a work experience. You will get job immediately. I can say, you just need to pass this part one. And,
Okay, okay, sir.
this RMO, uh,
Okay,
there is some grade inside 1, 2, 3, 4. So you will
okay,
get basically like in one, like no need for you to any of any RMP in Australia. So you have a lot of experience basically.
okay,
Okay,
sir.
and you'll get the salary also very high based on that.
What is the expected salary then?
Basically, after AMC part one, you are not a fully RMP, right? So you are in under the training, but still you will get around
Oh,
120,000, around 110,000, per year.
okay,
Indian rupees you can
okay,
say around 5 lakh or around.
okay.
Okay.
Thank you.
सर
Okay.
Yes.
Sir,
सर
sir,
मैंने
good evening. I'm
सर
Dr. Shruti, sir.
Yes, just sure thing.
Yeah.
You want?
Actually, sir, I have finished my MBBS in 2007, and I have did my MD Community Medicine and passed out in 2012. Since then, I have teaching experience of around 10 years, sir, 9 to 10
Hmm.
years.
Hmm.
So, like, how best scope I have, like, if I go to AMC, it would be better, or what would be your suggestion, sir?
Basically, in medical faculty, they also need registration. Without registration, medical faculty also, very difficult to get a job. Even in India also, you cannot get a job, because MCI, like, the license is mandatory. The same like in Australia, you must be
Yes.
a RMP, then only you can apply for jobs, And community medicine is it's not a clinical branch, it's not a non-clinical, it's kind of paraclinical, we can say, right? So in
Yes, sir.
Australia, if you are looking to migrate,
Yes.
most probably you will have a good scope in like public health, and in the community medicine. I mean, you can be a medical faculty here, or if you are if you are practicing, then you can go for this. Specialist path also you can try. How many publications you have?
Sir, I have around five publications, sir.
Okay. Is there any have in PubMed Index or SCI Index journal?
PubMed, yes, sir, I have.
Okay, then maybe you can give it a try
Hello.
for basically for specialist pathway. If not, then we are here to help you for this AMC.
Sir, is it necessary to have publications to apply
So,
for
like,
RMO job?
They give more weightage for those who have publications. Okay, without publications is very very difficult. Whether it is USMLE
okay,
or
sir.
PLAB or this AMC. So research is mandatory, but the problem in India, we
Okay.
are medical doctors are not much focusing on research. They're just in the clinical side.
Sir,
Sir, so
excuse me,
like I
sir.
have to clear the MC pathway, then only I can get through.
Yes,
Otherwise,
yes,
directly with community medicine, cannot get into public health also,
yes,
sir.
you can. Yes,
Sir, the next question is,
Pardon, sir?
yes, ready. Yeah.
Yes, sir. The thing is, you told about WBA program now, sir. Once we complete WBA, so what is the success ratio to get into the 19 hospitals in Australia after we complete AMC Part 1, sir?
I mean, you have to compete among the IMGs only. So
Okay.
this is a competitive, basically 19 hospitals. So all the
Okay.
IMGs will try for these hospitals.
That
So
one is, so what is the success ratio of getting there? Like in how many months, or like how can we get there? Like you'll give assistance to get into that hospitals,
no, this is a
or
government hospital. No one can assist you. Your
okay,
CV only can assist you, basically. So we are not giving any false hope for you. But lot of
okay.
Indian doctors, they are basically getting and working there. You
And
will
after WBA program, if you have to get into residency, what is the procedure, sir?
once basically whether you are going for WBA or going for AMC Part 2, and you will
Yes,
get a
sir.
general registration. Then you have to apply for that residency.
So
And
which
with Australian license, like in which other countries you can work? Can we work in India after getting an Australian license?
Yes. So basically, US, UK, and Canada and Australia, if you have registration, you can work in India.
Okay, sir.
Sir, just one question, please. Sir, I want to ask that which months are better to apply for, like in which months we have more opportunity of getting into the hospitals after
But,
AMC result.
basically, this is very यहाँ तो vacancy रहती है, even if you go for this, in government website, so they are hiring yearly 3 times.
3 times.
Yes.
Okay. So
So
what are
whenever
those months?
Hmm.
What will be those months? Like if I'm planning to give exam in Feb, then my result will be out by March.
Yeah,
So
then you will get basically in June.
in June.
Yeah.
And if I give exam in March, then
I mean, next is the June only, na.
okay, June. And before
And this
up
is only like also depend on state to state. Each state have their own deadlines. So once you pass the exam, your full-time job to just start looking a job. That's it, and you will got within 1 month.
within,
Something.
so then in by what month they give us the work visa? Like after getting, if the hospital
There is
assures me that we will
there
give.
is no fixed formula when they will give you. This also depend on your own personal circumstances. For example, your medical, your police verification, and so many other things. But in general, once they give you the job offer, within few weeks they will issue a letter, and then you have to apply the visa.
Okay, so approximately how much time does it take? Like
There
then
is no
how when can
fixed
I?
time. It might take for you maybe 2 years, or might take for 2 weeks. So there is no fixed time line for anyone. This is like individual things, as I mentioned. Someone might have a tuberculosis. It might take more than 1 year to get a visa, even if he clear this exam. Someone might be diabetes, hepatitis or something, So there are so many other factors to get in this. But in general, visa 2 to 4 months or 6 months maximum you will get. You see
Sir,
that,
when
uh, uh,
class is starting, sir?
you see that the PLAB exam itself, they are taking 15 to 18 months to just getting a date and sit in the exam.
Yes, sir.
About,
Can you please tell me that for Perth area, what are the deadlines to apply?
No, you have to check. This is not my job. I have to see.
Okay,
I don't
okay,
know.
okay.
I mean, we can give you some links, basically, like then you have to go and see. And I can give you like live example maybe. Uh, there is some website called Workforce Australia. It's a government website. So government job basically, you can find here. I you can see here.
Yes, sir.
Canberra, Townsville is here. This is a government website basically. They
Yes,
are
sir.
looking here. Emergency, lot of those are working in emergency. You will get
Sir, I have done my 3 years in anesthesia emergency, and I'm currently also serving in emergency department in my government hospital of my state.
but I want to say those are just a plain MBBS. Psychiatry is very very hot, high demand in Australia.
Mm.
In India, people are not that much in demand in psychiatry basically, बट यहाँ पर इसका बहुत डिमांड रहता है, तो आप लोग उसको चूज कर, यू कैन सी हियर, इनको एक एडवर्टीजमेंट दो एडवर्टीज कैनबरा का था, ये डार्विन का है, और ये भी डार्विन का है ना, तो
But what about emergency department?
is very high.
Hello, sir.
So you can see here, RMO, emergency department only. This is,
So is it good? Like if I apply for emergency?
yes, very good.
Good. Okay.
But if you have previous experience, then only you can say.
Yes,
like,
sir. I have experience in emergency department only.
then definitely, there is a hot demand, I can say.
Namaskar, sir.
Yes, namaskar.
Thank you,
सर
sir.
मैंने लास्ट ईयर एमबीबीएस पास आउट किया है और मैं पीजी परस्यू करना चाह रहा हूँ नेक्स्ट ईयर ऑस्ट्रेलिया से।
तो
तो
ऑस्ट्रेलिया में ऐसा नहीं होता है बेसिकली। ऑस्ट्रेलिया में सिंपल क्या है, पहले आपको अपना रजिस्ट्रेशन करना है।
हाँ जी,
बेसिकली
AMC 1 दी थी।
आपको पढ़ाई करना है, if you want to do in स्टडी इन ऑस्ट्रेलिया, तो जैसे इंडिया में होता है कि क्लिनिकल और नॉन क्लिनिकल, ठीक है।
हाँ।
तो नॉन क्लिनिकल के लिए तो कोई एग्जाम नहीं देना पड़ता, डायरेक्टली एडिशन हो जाता है। फॉर एग्जांपल एनाटॉमी, फिजियोलॉजी, मे बी फार्माकोलॉजी, पब्लिक हेल्थ, हेल्थ पॉलिसी, एक्स वाई जेड, सो मेनी ब्रांचेस, राइट। तो उसमें तो कोई इतना वो नहीं है। मगर इफ यू वांट टू गो फॉर क्लिनिकल ब्रांच, then you have to register yourself as a RMP. Then you have to go for documentation process, AMC part 1, AMC part 2, and register yourself. Then 1 year there is a residency. This RMO you have to work for 1 year. Then you have to go for the residency.
मतलब जो सर ये जो अपना प्रोसेस है AMC 1 AMC 2 और उसके बाद 1 साल की रेसिडेंसी,
yes,
उसके बाद हमें फिर से अप्लाई करना रहेगा।
yes. वो बेसिकली यहाँ पे इट इज नॉट लाइक इंडिया। इंडिया में लाइक नीट पीजी होता है, राइट।
हाँ।
और वो नीट पीजी एप्लीकेबल है वो पूरे इंडिया के लिए। वो बेटर तमिलनाडु हो, जम्मू कश्मीर है या नॉर्थ ईस्ट है, कहीं भी है, सब जगह एप्लीकेबल रहता है इंडिया में नीट पीजी। बट इन ऑस्ट्रेलिया वी डू नॉट हैव सच काइंड ऑफ एग्जाम। So here each university or each hospital, they have their own criteria.
Okay.
So for example, some might be take like short interview and they will see your CV, they can give you the admission. Some might take first test, then interview, and then they will make the selection like this.
सर चांसेस कैसे रहते हैं एडमिशन के इसमें पीजी में?
अरे भाई, तुमको करने के बाद ही तुमको 2 करोड़ की सैलरी मिल जाएगी। तो यहाँ कुल करते नहीं है लोग। जितने भी इंडियन यहाँ पे आते हैं वो जीपी बन के रह जाते हैं मैक्सिमम लोग, ठीक है। बिकॉज वेरी हाई सैलरी मिल जाती है लोगों को। उस टाइम तो लोगों की एज ही इतनी हो जाती है, शादी हो जाती है, बच्चे हो जाते हैं भैया, है ना। तो फिर क्या रहता है, यार चलो यार जो मिल रहा है वही अभी उसी में हैप्पी है, तो 2 करोड़ मिल रहे हैं, वी आर फाइन। तो ऐसे बहुत सारे लोग इंडियन जाते नहीं है, मगर चांस तो रहते हैं। यहाँ पर कोई भी डिस्क्रिमिनेशन नहीं है कि आप IMG हो और ये एक लोकल है। यहाँ पर ये अच्छी बात है। और IMG यहाँ पर बेटर कर रहे हैं एज कम्पेयर टू लोकल्स।
ओके।
और यहाँ पर जो डॉक्टर्स हैं, अगर आप देखोगे मैक्सिमम अभी राइट नाउ जो पिछले 5 साल से, पहले यहाँ पर नहीं आते थे, अभी 5 साल से यहाँ पर इंडियन भर भर के आ रहा है। पहले क्या साल लोग जाते थे यूएस में, यूएस जाते थे या यूके जाते थे, ऑस्ट्रेलिया कोई आता नहीं था पहले। अभी यहाँ बहुत आ रहे हैं। और गुड न्यूज ये है कि इंडिया से बहुत ही अच्छा रिलेशन है ऑस्ट्रेलिया का। अगर आप न्यूज को फॉलो करते हो तो यहाँ के PM 2 बार इंडिया गए थे। इवन हमारे अपने यहाँ पर 2 बार आए थे ऑस्ट्रेलिया में। तो यहाँ से मतलब बहुत अच्छा रिलेशन है। तो अभी बहुत ही राइड वो चल रहा है। इवन कुछ वो चल रहा है कि वेव कर दिया, जैसे कि एपिक वेरिफिकेशन वाला शायद खत्म कर दिया जाए कुछ टाइम के बाद में। AMC पोर्टफोलियो वाला वो भी अभी एक न्यूज आई थी अभी, वो चल रहा है अभी। तो बहुत सारी जो है क्रेडेंशियल्स होने हैं इंडिया और ऑस्ट्रेलिया के अंदर। तो राइट टाइम है आपके लिए मूव करने की।
ओके सर, तो आप कह रहे हैं जो RMD की सैलरी है,
R&D
मेडिकल प्रैक्टिशनर जो
GP
जनरल प्रैक्टिशनर ओके।
हाँ, उसको मिल जाते हैं करीब, मैंने अभी बताया था उसमें स्लाइड्स में, 3-4 लाख तक आराम से कमा लेते हैं पर ईयर।
3-4 लाख
$3-4 इंडियन रुपीज में भी 1.2 to 2 CR
और ऑस्ट्रेलियन डॉलर्स ना सर?
हाँ, इंडियन रुपीज में 2 CR लगा लो भाई।
ओके
Sir,
Hello,
can I
sir.
ask a question?
ये रुतिजा।
Sir, I wanted to ask, sir, I am a pathologist working in India since 5 years. I have 5 years post PG experience. And now I want to ask if after I clear my AMC part 2, what's the chance that I get to practice again in pathology or I have to switch branches?
But basically, you are if you are working last 5 years in pathology, so I can say a little bit, you cannot make your story easily. The changing, like, the branch is not very easy for you because
Mhm.
it is 5 years you are working. But
Yeah,
basically, for you to getting, in pathology is very, very easy. You will get the job.
that is after AMC part 1, or I have.
Even part one also, you can get the job.
Okay, with the CV and showing the work experience, it will
Yes,
work in my favor. Okay,
yes,
okay.
yes, yes, yes.
Understood, sir. Thank you.
Sure.
Hello, sir. I have a question that everyone has to go through residency, or without residency also you can get a job.
No, I'm not telling. Residency means if you want to go any specialist, if you want to become a specialist, then you have to go for residency. But we are talking about, कि just आपको अगर job करनी है, आपको doctor बनना है, then you just need to pass the exam and you can get a job in hospital.
All right. And the experience of India would count there?
Yes, 100%.
You
I
know,
mean, India का experience तो हर जगह पे इतने patient देखते हैं India में. As I mentioned in my PPT, 60 patient per day you can see. This is limitation in Australia. बट इन इंडिया 200
okay.
150 200 भी देखते हैं आप लोग, राइट? तो
जी.
जो एक्सपीरियंस है ना, बहुत ज्यादा रिच माना जाता है, मतलब बहुत ज्यादा, क्योंकि ज्यादा आपको एक्सपोजर मिलता है, ज्यादा पेशेंट आप लोग देखते हो, उसको अच्छा माना जाता है यहाँ पर.
सर मतलब
Okay.
WPG
और हमारे पास
एग्जाम
additional qualifications जैसे रही, we are trained in robotic surgery, minimal access surgery, ये सब किया हुआ है. So would I get an upper edge there in terms of post and salary?
अपर एज रहेगा.
So if I tell you,
आरएमओ के अंडर भी ऐसे कुछ वो रहती है ग्रेडिंग 1 2 3 4, है ना? तो वो आपको अपर वाला मिलेगा, और आपको में एक्सपीरियंस है, आपने कुछ एक्स्ट्रा वो किया हुआ था.
तो मेरा जैसे 12 साल का सर्जरी एक्सपीरियंस है, प्लस आई एम ट्रेन्ड इन रोबोटिक्स एंड मिनिमल एक्सेस. तो
तो
व्हाट
आप
अमाउंट ऑफ
आप क्या करो, आप बेसिकली उस पे अप्लाई करो, पाथवे पर.
सॉरी क्या मैं अप्लाई करो बोल रहा?
हाँ, तो प्लीज म्यूट वही करे जिसको बात करना है, अदरवाइज प्लीज एवरीवन. अरे यार,
या सॉरी आप कुछ बोल रहे थे.
यस. तो बेसिकली अगर आपको 12 साल का एक्सपीरियंस है, देन यू कैन ट्राई फॉर स्पेशलिस्ट पाथवे, नो नीड टू राइट द एग्जाम.
ओके.
आपने
Right.
एमडी
And what would be the salary?
हमने एमएस किया हुआ है ना.
हाँ MS NCH किया है मैंने.
हाँ, तो तुम डायरेक्टली आ सकते हो स्पेशलिस्ट पाथवे पे. इफ यू हैव 12 ईयर एक्सपीरियंस, जिसको 10 साल प्लस का एक्सपीरियंस है, दे मस्ट ट्राई, एटलीस्ट जिसको 8 साल का भी एक्सपीरियंस है, दे मस्ट ट्राई फॉर स्पेशलिस्ट पाथवे, and in that there is no need to write any exam. Directly you have to come for fellowship for 1 year, and then you can be a specialist.
Okay. And what would be the salary roughly in specialist program?
Maybe 4-5 करोड़ लगा लो. जीपी को अगर 2 CR मिल रहा है, तो उसको 2-3 गुना ही लगा लो.
सर मेरा एक क्वेश्चन है, सॉरी मैं थोड़ा लेट हो गई ज्वाइन करने
Guys,
में.
I am here for
Can I
2
ask?
hours. I am here for 2 hours. Please ask one by one. Okay.
Okay,
And
sorry. So
might be others asking some question, so it is also important for you to listen. Yes, Lakshmi.
yes. सर मैंने अभी लास्ट ईयर ही रशिया से अपनी MBBS कंप्लीट करी है, और मेरे FMG में इस बार अपीयर हुई थी, तो मैं सिर्फ 5 मार्क्स से कम रह गई हूँ. तो अभी मेरा, जैसे कहते हैं ना, आपको पता है पासिंग परसेंटेज FMG की बहुत पर ईयर बहुत कम होती जा रही है. तो मैं सोच रही थी कि मैं ऑस्ट्रेलिया, हाँ जी, ऑस्ट्रेलिया के एग्जाम के लिए मैं प्रिपेयर करूं, तो मैं क्या कर सकती हूँ, मतलब मुझे कोई जानकारी नहीं, आप मुझे थोड़ा गाइड करेंगे?
हाँ, we have basically so many students like you, basically, even our
Okay.
own faculty, we have one faculty like you, basically she graduated from China, and
Okay.
she is a citizen of Sri Lanka, and she
Okay.
had this exam. Now she's practicing and working here in Sydney. So basically you just need to check your college must be in the world, that medical directory list.
Okay.
If it is in the list, then you are eligible to sit in this exam.
Okay. तो सर ये एग्जाम जो होता है साल में 2 बार होता है या फिर
ये होता है 10 बार पूरे
10
दुनिया
बार?
में सबसे. हाँ, मैंने भी
Okay,
यही बताया
okay.
था कि ये सिर्फ दिसंबर और जनवरी को छोड़ के आप
Okay.
कभी भी दे सकते हो. ये एग्जाम हर महीने होता है. 15 एग्जाम सेंटर है इंडिया के अंदर इसके AMC के.
ओके सर, और सर एक चीज और पूछ रही थी, जैसे कि इसका पासिंग परसेंटेज क्या है, मतलब
ये
एग्जाम का?
पार्ट 1 का है अराउंड अप टू 70%, ये अराउंड
ओके
55 to 70% के बीच में रहता है पार्ट 1। और
ओके।
पार्ट जो है वो थोड़ा सा टफ है, वो रहता है अराउंड 25%।
तो सर जैसे हम पार्ट 1 के लिए प्रिपेयर करेंगे और पास हो जाएंगे, तो पार्ट 1 के बाद भी हम वहाँ पे जा सकते हैं, या फिर पार्ट 2 क्लियर करने के बाद ही आप मूव कर सकते हैं?
पार्ट 1 के बाद आपको जेएमओ की जॉब मिल सकती है, मगर
ओके
एडवाइस ये
सर।
है कि आप इंडिया में ही वहाँ रह के कुछ ना कुछ प्रैक्टिस करते हो, किसी क्लिनिक पे या कुछ भी कहीं पर भी।
ओके सर, तो अगर मैं मतलब मैं यहाँ पे प्रैक्टिस करती हूँ किसी हॉस्पिटल में, तो उसका मेरे को सीवी में प्लस पॉइंट मेरे को मिलेगा?
यस।
ओके, थैंक यू सो मच सर।
Please, anyone is
Hello,
here?
sir.
Please,
Hello.
sir.
yes, please, just 1 minute. Please do not show in your CV any gap.
ओके
If there is any gap, so please give a very valid reason. For example, any woman, कुछ शादी हो गया
ओके।
या कुछ
हाँ
प्रेगनेंसी हो
जी।
गया, कुछ ब्रेक ले लिया तो इज ओके। बट बहुत सारे लोग हैं ना
ओके
कि मैं 6 महीने से काम नहीं कर रही हूँ, तो भाई यहाँ पर एक्सप्लेनेशन देना पड़ता है क्यों नहीं कर रहे हो आप अपने 6 महीने से काम। ओके, तो
हाँ
प्लीज
जी। हाँ जी।
ट्राई टू डोंट गिव द मतलब आपको गैप नहीं छोड़ना है अपने सीवी के अंदर।
गैप नहीं छोड़ना। ओके, थैंक यू सो मच सर, मैं याद रखूंगी इस
Hello,
चीज को।
थैंक यू।
hello, sir.
Good evening, sir.
Hello.
Hello.
I have a question.
Yes.
Yeah. If I get married to someone who is already a PR and I get a say temporary visa, so can I give it from the Australia itself?
यस, फिर तो आपको तो कोई चक्कर ही नहीं है, आपको तो डायरेक्टली जस्ट एएमसी पार्ट करना है, पास 1। मतलब यू कैन पास इन इंडिया, अगर आप पास लेते हो तो फिर आपको डायरेक्टली जॉब मिल जाएगी यहाँ पर।
Oh, okay. And okay, there's one more question. So, if we are already living in Australia in case of marriage, then are there any centers readily available in Australia? Like you're saying, centers coming up from Australia.
अरे इंडिया में भैया 15 सेंटर हैं, तो ऑस्ट्रेलिया में कितने सेंटर होंगे? बहुत
Okay.
सेंटर हैं। यस।
Fine. Okay.
इन विच सिटी यू आर प्लानिंग टू कम?
Sydney.
यार सिडनी में तो भर भर के ये यार बगल में ही हमारे एक सेंटर है यहाँ पर पैरामीटा में।
Okay.
बहुत सेंटर होते हैं, इसलिए जो पियर्सन व्यू होता है ना,
Uh-huh.
वर्ल्ड वाइड में बहुत सारे जो एग्जाम कंडक्ट कराते हैं, ये वहाँ सेंटर होता है इनका, तो
Okay.
बहुत है उसके यहाँ पर।
Okay. No worries. Thank you so much. Yeah.
थैंक यू कुंजन।
Hello. Hello, sir.
Yes,
Good evening.
Sir, I'm from Nepal.
Yes,
I've completed MD gynecology and I've been practicing infertility for 6 years. So, and I also got an opportunity for PhD program in Monash. But when I talked with them, they said like it would be better if you give AMC and come. So you can just work and also continue with
No,
PhD.
I mean, if you are getting PhD, you can come. That is a best route for you, and simultaneously you can write AMC part 1 and part 2.
Okay. So enrolling a PhD and then doing AMC, so don't you think it will be difficult?
वेरी पीएचडी में कुछ होता नहीं है। आई मीन आई डिड माय पीएचडी लास्ट मंथ। मैंने अभी रिसेंटली पीएचडी किया, यूनिवर्सिटी ऑफ सिडनी से किया है। यूनिवर्सिटी ऑफ सिडनी ऑस्ट्रेलिया का, आई डोंट नो, यू गाइस डोंट नो, इट्स लाइक कि मेडिकल में 17 रैंक है उसका पूरे वर्ल्ड में, ठीक है। और जो ऑस्ट्रेलिया का जो पहला मेडिकल स्कूल था, सिडनी मेडिकल स्कूल, यूनिवर्सिटी ऑफ सिडनी का ही है ना, तो इनको बहुत रेपुटेशन है। तो पीएचडी में ऐसा कुछ नहीं होता है, बस कि आपको रिसर्च करनी होती है, वो आपको सुपरवाइजर आपसे अगर हैप्पी है तो आप पार्ट टाइम भी, is not a big deal.
Okay. Agar like if I don't want to do PhD and I want to apply for specialist pathway.
मैंने सिंपल सा फार्मूला में बता रहा आपको, उस वीजा पे आप आ जाओ, एग्जाम को पास कर लो, फिर उसको पीएचडी को छोड़ देना। मैं नहीं बोल कंप्लीट करो पीएचडी, बट they are giving you the offer, so you can accept the offer and come to Australia. But I don't know if they are saying that this is like a पीएचडी 2 तरह का होता है ऑस्ट्रेलिया में। कोई भी यूनिवर्सिटी पीएचडी देती है यहाँ पर, वो बोलती है फीस पे करो।
No, it will be scholarship. Actually, like they have I'm a IVF specialist here, but they have offered me PhD in pharmacogenomics in controlled ovarian stimulation. So thoda ye like pharmacogenomics जैसे जा रहा है.
So your aim to be a specialist in Australia or become a doctor in Australia, आपको उस वीजा पे आप आ जाओ, और साथ में आप इसको प्रिपेयर करते रहो आप इसको, और you can move in this side.
Okay, so I think if I can spare
Basically,
few hours, then I can pass. I mean, like I was scared, like doing PhD, like it would be tough, and then I couldn't get time to study. So,
I mean, people are here. They are basically coming for master degree. They are working like part time. They are working. They are going to school. They are earning, and this and that. Very tough for them. But PhD is very easy going. So it's not that much big deal. Even you can start preparing now itself, and can pass part. You can give in India, or maybe you can come to Australia and write. Once you give part one, the company will sponsor you basically, the work visa. Then if you
okay.
want to continue, then you can.
Yeah, they have asked me to like do at least part one so that they can offer me job and all. But it's been so long that I'm not much into basics, and also I've been practicing solely in fertility. So are there any specific classes like which will help us appear in the exam?
Yes, we provide basically online classes. So this is very short and crisp. In 4 months, you are ready to go basically in exam.
Okay, so after the 4 month course, I mean class, we can appear in exam. I mean that
Yes.
is more than sufficient.
Yes.
Okay, so how long will be the classes, sir? Because I'm like I have work schedule.
We take live classes plus recorded. So if you miss any class, you will get the recorded session.
Okay,
Because since our faculty is in Sydney, so our timing is based on Sydney time. So 8 to 10 p.m. basically we take the class.
8 to 10 p.m. in morning.
No.
Sorry,
8
8 to 10.
p.m. in
Sorry, evening.
and
Okay.
basically the दोनों डॉक्टर्स हमारे जो हैं जॉब करते हैं ये लोग शाम में
Sorry.
5, ठीक है? So I mean,
Okay.
in Indian time or Nepal time might be like 2:30 around.
Okay.
And weekend पे 2 class होता है Saturday Sunday को. So at least like if you can like 2 maybe live or 2 can be like recorded sessions, still you can manage basically if you're working.
So week में how many days classes like आप
thank you, sir.
करेंगे schedule?
हम लोग basically we want to finish this syllabus basically within 4 months. So we have to keep classes 8 to 10 hours weekly.
8 to 10 weekly. Okay.
Yeah.
So अगर classes हम join करते हैं, is there any mock test to like अपने उसको
Yes, basically
clinical
mock
based
test
MCQs को?
yes, based on the topic. For example, we take XYZ lecture. Okay.
Okay.
Once this will finish, then we will give you the mock test.
Okay.
Okay. How much is the charge?
Okay.
Preparation.
This will give you, our team will give you the more information regarding the fees and all those things. But apart from the fees, you can ask me any question. So our team will get back to you after this.
So AMC की website पे portfolio भी बनाना होता है to get ID verification.
भैया हमने पहले बताया था हम बना देंगे वो आपका.
वो आप बनाएंगे.
मतलब
Okay.
We are helping you basically ना A to Z हम आपको help करेंगे. This is
okay.
सारी चीजें
जो आप और जो प्रिपरेशन के लिए सर AMC गाइड है वो भी आप प्रोवाइड करेंगे और वी हैव टू बाय इट
ourselves? हमारा जो लेक्चरर है वो आपको सारा रिसोर्स जो भी है इस एग्जाम के लिए वो प्रोवाइड कराएगा.
ओके सो वी डोंट नीड टू बाय AMC गाइड राइट फॉर प्रिपरेशन.
आपको कुछ बाय करने की जरूरत नहीं है, जो भी चीजें होंगी हम ही देंगे आपको.
ओके सर गॉट इट.
ओके इवन सम गाइडलाइंस दिस एंड दैट एवरीथिंग वी विल गिव यू. आवर लेक्चरर्स ने जैसे पास किया उन्होंने बहुत ही स्ट्रगल किया. अभी वी आर हेल्पिंग बेसिकली इट्स नॉट जस्ट वी आर डूइंग तो हम आपको पूरा जो भी चीज आपको चाहिए एग्जाम के लिए वी विल प्रोवाइड यू.
ओके सर.
सर गुड इवनिंग.
यस डॉक्टर चंद्रा.
Yeah, actually, I am recently graduated, sir, just this year June. So basically, I don't have any experience, and I didn't do any publications or any research programs. So, what are my chances to getting into the Australian program after clearing AMC1, given this high competition between the IMGs?
First of all, you have to start working. So if you are graduate in June, last 3-4 months what are you doing basically कि आपको job continue करना चाहिए. You have to work. So as I mentioned in your CV, please do not leave any blank space like For 4 months, I was
Okay,
not
sir.
working, and 6 months was not working. So
Okay,
experience is
sir.
very, very important here. Okay, even if you have a 6 month experience, it's good for you. You will get a job basically. Uh, and in India, में जो are you from India, right?
Yes, sir.
जो जिसने इंडिया से किया है बेसिकली तो इंटर्नशिप भी काउंट होता है एक्सपीरियंस में.
No, no,
ठीक है.
no. Actually, I am an IMG. I did my studies in
IMG.
some.
Okay.
Yeah.
So you don't have any work experience. Have you completed your internship there?
Yes, sir. We have 72 weeks of internship program. So just not like 1 year. Basically, I'm from Central American Belize country.
देखो अभी क्या है ना, you pass this in June or July whatever, and since
Okay.
then you have to show the work experience. वैसे भी you
So
are going.
actually, I went to some hospitals just to learn work. So basically, to put into words, I can say that I did my observership in two departments.
Observership or maybe junior officer or medical officer or something, you can say, because you are not
Yeah.
legally to work in India because you are not cleared FMG, right?
Yeah, yeah.
Yes, so you can show that kind of experience also.
So would it be good for me to go now, or should I do 1 year internship just like after getting an FMG license? Would that be good?
No. You just pass the exam and continuously work and try for job here. So this is not like ये नहीं कि आपने एग्जाम पास कर लिया and there's a gap, कि आपको जॉब नहीं मिलेगा 1 साल के बाद या बाद में. आपको एग्जाम एक ही बार में पास
Yeah.
करना है, तो आपने वंस पास करो और जॉब करते रहो बेसिकली इंडिया में भी, और यहाँ अप्लाई करते रहो
पर
बेसिकली उसके
सर
चांस.
जैसे कि आप बता रहे हैं कि हमारे को सीवी में गैप नहीं होना चाहिए, जिनका एफएमजी क्लियर नहीं है, वो रजिस्टर्ड नहीं है, वो फिर कैसे शो अप करेंगे कि हमने ऑब्जर्वरशिप, लाइक इज इट लीगल टू शो?
यस, ऑब्जर्वेशन यू कैन, इवन इन ऑस्ट्रेलिया में भी ऑब्जर्वेशन होती है यहाँ पर.
ओके, तो ये एड अप होना जरूरी है और ये हमारे उसको अच्छा भी दिखाएगा कि हाँ इन्होंने यहाँ पे
यस
ऑब्जर्वशिप किया है.
यस भाई, बहुत सारे
ओके
तो
ओके.
इंडिया में क्या करते हैं लोग,
हाँ जी.
दो 3 साल में तो क्लियर हो पा रहा है एफएमजी. ठीक है.
हाँ जी.
3 साल लगा दिए एफएमजी क्लियर करने में, और फिर 1-2 साल तक उसको इंटर्नशिप नहीं मिलती. गवर्नमेंट के वहाँ पर लिमिटेड नंबर होती है इंटर्नशिप इंडिया के अंदर, राइट.
बहुत बुरा हाल है सर. यस.
तो 5-5 साल लग जा रहे हैं लोगों को इंटर्नशिप खत्म करने में ही.
हाँ जी.
देख रहा था कुछ स्टूडेंट को कि वो राजस्थान में उन्होंने ऐसी स्ट्राइक किया हुआ था कि उनको सीट नहीं, उन्होंने एफएमजी पास कर लिया तभी उनको सीट नहीं मिल रही है इंटर्नशिप के लिए. ये
आई
हाल चल
नो
रहा है.
सम ऑफ माय फ्रेंड्स, यही चल रहा है सर अभी तो.
हाँ,
बहुत बुरा हाल है.
तो मैं वही बोला, जहाँ तो इतना कुछ भी नहीं गया, आपने जो पास कर लिया 1-2 महीने आगे पीछे हो सकता है, पर आपको यहाँ पर मिलेगा ही मिलेगा.
ओके सर. ओके.
और
Sir,
एक्चुअली
and also,
एक जॉब का फार्मूला ये है कि यू मस्ट बी रेडी टू वर्क एनीवेयर इन ऑस्ट्रेलिया.
ओके.
आप चॉइस नहीं रखोगे कि भाई मेरे को सिडनी में जाना है, मैं सिडनी में जॉब करूंगी. अगर ऐसा कोई चॉइस रखता है तो उसके जो लो चांस रहेंगे जॉब मिलने के. तो आप ओपन रहे कि भाई कहीं भी मिल जाए मुझे ऑस्ट्रेलिया में, मैं आ जाऊंगी. और ऑस्ट्रेलिया बहुत ही सेफ कंट्री है, आप बिल्कुल डरने की कोई ऐसी बात नहीं है, बहुत सेफ कंट्री है ऑस्ट्रेलिया. आप पहले यहाँ पे आ जाओ और उसके बाद फिर आप मूव कर जाना 2-3 साल के बाद में.
Question, please.
sir, actually, one more question.
Yes, please.
If we don't get into these 19 hospitals, will your Academically Institute will be able to assist us to get a WBA program in these 19
No.
hospitals?
No.
No?
Basically, our job to help you to pass the exam. We are an education company. We are not charging you anything for any other service. We are only
Okay.
charging you what course we are offering you. Okay. But personally, I basically guide my all students जो भी हमारे यहाँ से पास करते हैं, whether it is AMC और फार्मासिस्ट, नर्स, लैब टेक्नीशियन, हम सबको कराते हैं. हमारे पास में 1500 प्लस बच्चे हमारे यहाँ से अभी ग्रेजुएट हो चुके हैं एकेडमिकली से. ठीक है. तो हम सबको हेल्प करते हैं. तो उसमें 3 चीजें होती हैं एग्जाम पास करते होते हैं, जॉब के लिए. तो जॉब कैसे मिलेगी, आपका CV, आपका कवर लेटर हम लोग चेंज कराएंगे. ठीक है. कि क्या ठीक है उसमें, वो थोड़ा आप चेंज कर लो. हम देख के हमारे लेक्चर को गाइड कर दे कहाँ ऐसे कर लो, ऐसे करो. ठीक है. उसके बाद में कौन कौन सी यहाँ पर जॉब लगवाती है, वेबसाइट कौन कौन सी, कहाँ कहाँ पर अपना CV आप डालोगे, और CV पे एंड कौन कौन सी यहाँ पर एजेंसी जो होती है, यहाँ पर बहुत सारी कंसल्टेंसी होती है जॉब लगवाती है, वो भी हम आपको उनसे कनेक्ट कराएंगे. हमारे पास बहुत सारी जॉब भी आती रहती है, वो भी हम आपको शेयर करेंगे. बट वी आर नॉट प्रोमिसिंग कि हम आपको जॉब देंगे. वी आर नॉट ए एजेंट. ठीक है. दिस इज योर, आप किसी भी, हम तो बेसिकली अभी नेक्स्ट मंथ हम लोग वी आर गोइंग टू लॉन्च अवर यूएस असेंबली एंड प्लैब आल्सो. ओके. So
Actually, my question is, if we get other than these 19 hospitals, can we
yes.
take the
अगर
WBA
आपको
program?
अगर ऑस्ट्रेलिया में आपको कहीं भी जॉब मिल गया, आपने 6
Yeah,
मंथ की जॉब कर लिया, फिर आपको
yeah.
बहुत इजी रहेगा WBA प्रोग्राम में एंट्री करना.
Okay. So it's
Yes.
not that only these 19 hospitals who are doing the job in these 19 hospitals will be
No,
able
no,
to give the WBA.
जॉब यू कैन वर्क एनीवेयर, स्पेशली इन प्राइवेट हॉस्पिटल्स में तो बहुत ज्यादा जॉब्स रहती हैं.
Okay,
आरएमओ
okay.
हॉस्पिटल यहाँ पर इतने नहीं होते हैं, यहाँ पर मेनली गवर्नमेंट
Okay.
फंडेड सिस्टम है यहाँ पर.
So anyone after AMC 1 can do the WA program, regardless of the location.
Yes, yes, yes.
सर और
Okay, sir.
क्वेश्चन
सर IVF
कैन
infertility में
वी
जॉब मिलना कितना डिफिकल्ट है?
प्लीज क्या करते?
सर one question please.
IVF
Is
में
it
जॉब
possible to
मिलना
get a
कितना
job
डिफिकल्टीज
after
है?
passing AMC in GP?
अच्छा, आकृति, you are asking the job opportunities for IVF, right?
Yeah, but after AMC part 1, because I don't want to work as a general obstetrician because I've been practicing IVF for 5-6 years, so I want to like
No, I
work
mean,
there.
you have like experience. I don't think so. You have a problem. You will get definitely. Even one of my friend, his name is Dr. Gufran. He's from
Mm-hmm.
Pakistan, so he did MBBS, MD, and he's a PhD basically in your field. So right now he's
Okay,
working in Melbourne in one hospital. Basically, he's a lab in charge basically. तो ऐसे
okay,
जॉब मिल जाती है, जॉब को ऐसा प्रॉब्लम नहीं है आपकी फील्ड में.
okay,
Is
okay.
it
Thank you.
possible
Thank
to get a job after passing AMC? I mean in GP?
No. बेसिकली जीपी क्या है? जीपी इटसेल्फ ए स्पेशलिटी इन ऑस्ट्रेलिया.
Yep.
कोई भी हाई इनकम कंट्री में, वेदर इट इज यूएस, यूके, यूरोप, ऑस्ट्रेलिया, ये सारी जगह पर क्या है, आपको बेसिकली वंस यू पास दिस एएमसी पार्ट 1 एंड पार्ट 2, देन यू विल बी आरएमओ, रेजिडेंट मेडिकल ऑफिसर. नाउ एवरीवन हैज टू फाइट टू गेट ए रेजिडेंसी इन द सेंस, जीपी आपको बनना है तो आप जाओ फैमिली मेडिसिन में, ठीक है. बाकी किसी को सर्जन बनना
Yes.
है, किसी को इंटरनल मेडिसिन में करना है, या किसी को किसी और ब्रांच में करना है, तो फिर वो ऐसे सबको करना पड़ता है. ये भी स्पेशलिटी है ऑस्ट्रेलिया के अंदर, ये फैमिली मेडिसिन इसको बोलते हैं इन जनरल, और उसी को जीपी बोला जाता है जैसे ना. तो वो, और सबसे ज्यादा जीपी की ही यहाँ पर डिमांड है. मैक्सिमम जो डिमांड है ना, वो जीपी की ही डिमांड है. और यहाँ एक प्रॉब्लम क्या है, बहुत सारी पॉपुलेशन यहाँ पे जेरियाट्रिक पॉपुलेशन है, और अगले 10 साल में बहुत सारी पॉपुलेशन यहाँ की जेरियाट्रिक होने वाली है. इसीलिए ये लोग 2 लाख के आसपास बाहर से लेते हैं, दूसरी कंट्री से पीआर देते हैं, एसोसिएशन देते हैं कि आप हमारे यहाँ पे आओ, काम करो.
Okay, thank
So
you.
what is the PG exam name in Australia?
क्या रिपीट अगेन?
What is the entrance exam for the specialization program to get into the Australia after AMC2?
देयर इज नो एंट्रेंस एग्जाम. मैंने बताया था इंडिया में नीट पीजी होता है, यहाँ पे ऐसा कोई एग्जाम नहीं होता है. तो यहाँ पर हर
Okay.
यूनिवर्सिटी, हर हॉस्पिटल का अपना क्राइटेरिया है. तो
Okay,
फॉर
sir.
एग्जाम्पल यूनिवर्सिटी ऑफ सिडनी, फॉर एग्जाम्पल, वो एक मिनी टेस्ट लेते हैं काइंड ऑफ, फिर इंटरव्यू करते हैं और फिर सिलेक्शन करते हैं वो. तो ऐसा हर एक का अपना अपना अलग है. यहाँ पर कोई ऐसा यूनिवर्सल कोई एग्जाम नहीं है पूरे ऑस्ट्रेलिया के लिए.
Okay. So will there be any exit exam so as that we will be certified our PG program is completed like that?
ये दिस इज बेसिकली, अगर जैसे डब्ल्यूबीए में आप जाते हो फॉर एग्जांपल, तो डब्ल्यूबीए में आपके ऐसे एग्जाम्स होते हैं, वो आपको वहाँ सर्टिफाई कर देते हैं. पर ऐसे इसे करने के बाद तो कोई ऐसा एग्जाम नहीं है लाइक इंडिया में जो अभी बात चल रही है.
Okay. So just for us to give an idea, can you just send us any PDFs regarding this AMC question paper, just 1 or 2, so that we know the pattern and how difficult the questions are?
I think you can watch some videos from our faculty. I have basically uploaded on YouTube, and our team will give you the more information also. So if you can just अरे यार ये कहाँ, तौसीफ, दिस इज EMC का बात कर रहे हो तुम, और इस चैनल पर तुमने से, ठीक है. तो बेसिकली दिस इज द चैनल बेसिकली वी हैव, इट इज फॉर IMGs ओनली, ठीक है.
Okay, sir.
Hello.
Sir,
So
when is the next batch starting for AMC Part 1 training?
इज गोइंग टू बी नेक्स्ट वीक. ये जो फैकल्टी है सैटरडे को मेरे यहाँ पे आने वाले हैं, हमारे घर पे, हमारे ऑफिस में. तो बेसिकली वी आर प्लानिंग टू होपफुली इन द नेक्स्ट वीक, इन 1 वीक, तो मैं बताऊँ आपको कौन सा वीडियो आपको देखना है. ये जो वीडियो है ना हमारा, ये जो वीडियो है, इट इज फॉर IMGs ओनली, ठीक है. So मैं बताऊं आपको कौन सा वीडियो आपको देखना है. ये जो वीडियो है ना हमारा, This is Dr. Udara, Dr. Swapnil Sharma. So you can watch this video. Okay?
Hello.
Yes.
Hello, sir.
Yes, please.
Sir, for specialist pathway, the AMC is compulsory.
First part, the AMC exam you are asking the compulsory?
Yeah.
No. For specialist pathway, they want to see your master degree plus
Okay.
your experience.
Okay,
There is
sir.
no need to write the exam.
MS, I have 10 years experience.
Okay. MS. Yeah, then you can give it try. But I mentioned that you must be have something special in the sense some publications, some research, or some specific any training you did for
Yeah.
Yeah. Then you can give it try.
So you have to, that's online or your this one academy will help us or something like that?
No, especially pathway, we are not helping. We are helping for exam preparation for AMC. So that you have to go to AMC website, Australian Medical Council, and you just choose the specialist pathway. There's a very straight away, application process. You can apply there directly.
Thank you, sir.
Thank you.
So, if we have our relatives already having PR and settled in Australia, so does that help in any way to get a job there?
Maybe they can help you. Yes, definitely. They must be know some GP or something. They might help you. Yes.
Yeah, they're also doctors, so that
डेफिनेटली तो क्या है अगर कोई डॉक्टर है तो 100% आपको जॉब दिलवा ही देगा वो फिर तो आपको कोई प्रॉब्लम नहीं फिर तो आपको एएमसी पास ही करना है देयर इज नो प्रॉब्लम but I don't know, this is my personal experience or personal opinion or maybe advice for you, so please don't basically rely on any of your relative.
yes sir.
जितने भी रिलेटिव्स होते हैं ना अभी बोलेंगे हाँ आप आ जाओ आप ये करेंगे जब आप यहाँ आ जाओगे ना तो मालूम है आपको लेने में नहीं पहुंच रहा है वो बंदा ये नहीं पता कि आपका
that's like any letter of recommendation. Yeah. Okay.
And this is also another thing. If you asking any Indian,
yes sir,
so he will show a lot of problems here. Don't come here. This and that. This is also many people like they're like jealousy feeling. They're feeling like why you are coming here. This and that. So they might So please make your own decision. And Australia, I can say one of the most beautiful country, and you must try basically. कि आपको ऑस्ट्रेलिया आना ही चाहिए.
Okay, sir.
Hi, Dr. Abhinaya.
Hello, sir.
Yes.
Sir, good evening, sir. Sir, I joined in a little lately because of my duty. Sorry for that, sir. Sir, I'm basically from India. I did my MBBS and MD General Medicine. I have 2 years of experience as a consultant physician here. I'm planning to give my AMC, sir. I have never left India, so I have nobody in Australia or something. I'm just asking, like, what will be the duration, approximately the duration for me to get the job after I clear AMC once, sir?
So there is no fixed formula, but in general, in my personal experience, it might take 1 to 6 months to get a job and visa and all those things.
Okay, sir. Sir, but if I get a job, will they sponsor my visa, sir, or I should work on my visa now?
Mostly, if you are getting a job, they will sponsor you work visa, not PR visa. PR visa you will get once you pass part 2, once you get the full registration.
Okay, sir. Okay, sir. Sir, actually, sir, I'm getting around 18 lakhs per annum around that in India. What can I expect, sir? What can I expect my salary after clearing AMC Part 1, working as a junior medical officer in Australia? What can I expect?
I mean, basically, this is not a job. You are under training. So please don't count. This is like a salary. So they are given 70,000-80,000. This is like maybe more than 3 lakh per month. Okay. Even whatever you are getting in India, 18 lakh, you can save more than that in that, easily.
Okay.
Sir. You have to see once you become a GP or once you become, specialist, how much you can earn. You can earn up to 2 CR as a GP or as a specialist up to 5 CR per year. So you have to see the
Okay, okay, sir.
end outcome, not just
Okay,
the
sir. Okay.
okay, how much I can earn as a JMO. JMO is just a basically like a very
The
very very
starting.
yes, it's just a, a small destination I can say.
Okay, okay, thank you, sir. Sir, can I, like, I'm single, sir. I'm planning to move to Australia after getting a job. Can I take my parents with me, sir? Will they kind of, after some 2, 3 years or
This is
something?
very tricky question. In Australia, after 18, you are independent. So basically, they will give you a visa, you or your family. So family means you and your husband or kids. The parents are not on dependent on you. Okay, but once you move to migrate to Australia, then you can apply separately with a visa for them.
Okay, sir. Okay, sir. So you talked about publications. Will my postgraduate thesis count as publication, sir? My
No, no, no. Publication means you must publish in any peer review journal. Um,
okay, sir.
any PubMed index, ISI index, or Scopus index journals.
Okay, okay, sir. Okay. Thank you, sir. Thank you so much for your
Thank
patience.
you, thank you so much. Yes, next please. Yes, Akriti.
Yes, sir. So after AMC, like you said, working, it won't be a job, right?
No,
So
it is
unless
job.
we,
I'm not saying this is a job basically, but she's asking basically calculating the money, okay, how much she is going
okay,
to earn and save. So
uh,
I'm saying don't see this money. You have to see the end outcome. कि how much you are going
yeah,
to earn after you graduate. So इसमें जो पैसे मिलेंगे 70,000. 70,000 is
mm-hmm.
not a great salary or something for Australia. Because as a
Yeah,
government,
yeah,
you can earn maybe like up to 400K. So
mm,
400K and 70K is very, very, low amount.
yeah,
So I can give you my own example. When I came to Australia, I came on a scholarship. My scholarship by 28,700 I was getting per year. So
mm-hmm.
me and my wife, we live in Sydney in that amount, basically, nicely.
Yeah,
So
mm-hmm.
if you're getting 70,000 also is very good amount. It's not a very low amount. Okay, still you can save
Mm-hmm.
some in that.
Mm-hmm. Okay. So even if I pass step one and then I'm working, so I'm already like postgraduate, so I have to give like step two anyhow, right?
Yes, definitely. You want to get full registration, you have to give part two, or you can go for WBA program is here. If you want to bypass
Mhm.
this, WBA means work-based assessment. So you have to
Okay.
work, and they will see
Mm.
your assessment while you are working. So no need to
O-
write in that case part two.
Okay, okay, okay. Because you said part two is very difficult. I mean, like the passing rate is very less.
That's why
So leaving them.
many are IMGs nowadays they are going for WBA. So 19
Mm,
hospital they are offering this nowadays WBA
okay.
program. So you can go for WBA. And this is not very tough. In India, IAS, PCS exam is very, very tough. And a lot of
Mm,
doctors, I know personally, those are from AIMS and here and there are doing MBBS. Like
mm,
1 lakh, if they are giving this exam, hardly maybe, very few only pass in that exam. Still people are
yeah.
giving the exam. So this is not
Mm,
that bad, but a tough exam. I am 25% is not low. Every fourth, one of them is passed in the first attempt. But you can
okay.
bypass it, you can go for WBA program.
Okay. What about MRCOG? Like if we are MRCOG done, then still we have to give AMC?
Yes, this is a basic requirement.
Okay, thank you. Thank you.
Hello, sir.
Yes.
Sir, I just want to ask that if we pass AMC 1 and 2 and we did 1 year residency in Australia, and after that, what are the chances that we can get the PG in clinical subjects?
Yes, very good chance. I mean, if you are especially there is two things. Again,
Okay.
PG you can do in like in metro cities like Sydney or Melbourne, or some maybe if you are ready to go in regional areas. So regional areas, a lot of scope basically for IMGs. You will definitely
Okay.
will. And there are
Okay.
some branches are like, for example, psychiatry, emergency medicine. uh,
Okay.
sports medicine, very hot branches here.
Okay, sir. Oh, okay. Thank you, sir.
Thank you.
Uh,
Sir, over
Hello,
there,
sir.
residency is only 1 year. PG, that is.
Residency, residency 3 to 6 years.
Okay, okay.
This is any country, any high income country, whether it is Australia or US, Canada, 3 से 6 साल की होती है रेजिडेंसी. दिस इज बेस्ड ऑन योर कौन सा सब्जेक्ट में आप कर रहे हो.
Okay.
यस नेक्स्ट प्लीज.
Uh, Sir, I need to ask it again. Actually, I have not passed DNB, and it's 10 years of experience after the training completion. But I saw in specialist registration pathway, they have mentioned that partial training or qualification won't be considered. So will it be considered as a partial qualification?
I can't comment, I have no experience, but you can just write them the email and ask them, they might give you the clarification, or maybe you can go for AMC if you have any doubt. तो आप उनको ईमेल कर दो, दे विल रिप्लाई टू यू. ना यहाँ पर रिप्लाई बहुत करते हैं. वो एक दिन लेगा पर रिप्लाई
Oh,
जरूर करेगा आपकी ईमेल को.
okay, sir.
ओके, थैंक यू. यस नेक्स्ट प्लीज.
Sir, good evening, sir.
गुड इवनिंग.
Sir, yes, sir. I'm basically graduated from Philippines, sir. I'm from India. I'm IMG. I graduated like 2020 January, sir, before COVID. Sir, I'm trying to crack the FMG for past 3.5 years, but
Last
can't able
years,
to.
are you working somewhere or not?
No, sir. So, doing some relieving duties
This
and
is
then
the
preparing.
main issue in India is IMG is facing basically, 5
Yes,
years,
sir, but
3 years they are waste basically, कि after
sir,
they are.
but only 1 or 2 marks, like for 148, 149.
Whatever, fail is fail, maybe it's one point or 10
So
point.
that's what I'm
You are the
planning to give.
3.5 years you waste basically. If you can take that time step, maybe USMLE or PLAB or AMC, so you will be here only, right?
Yes, sir. Now planning to give a AMC, sir, in through your academically. But as you said, in our CV, we can't able to show that 3.5 years in the blank space, sir. So is there any what is the possibility of getting job after AMC one, sir?
No,
For
I mean, if someone can give you a letter
Okay.
or any hospital something,
Okay.
you are working there or something, then you can. Not a medical officer,
Okay.
but kind of junior or assistant or whatever they can.
Sir, is that okay? They are accepting like before passing FMG or registration, they can accept that giving hospital letters, sir. The letter is accepting over there in Australia.
Yeah, I mean, this is like a job you're applying. This is not kind of like visa or government or something.
Okay.
You are
Yes,
just
sir.
applying for a job, and in that job, the CV they will see.
Okay.
If you are showing that yeah, I was working here and these are my duties, and they will
Okay.
ask you the question. If he's satisfied, he will give you the job.
Sure, sir.
Yeah.
Okay. Thank you, sir.
Thank you. Yes, next please. Dr. Ajazwani. Dheeraj.
Yeah, I want to know what is the expenses of EMC and your course too.
It is more less than 5-6 lakh hardly total. I
Okay.
will give you the exact amount, but I'm just giving you the rough estimation. And you are
Okay.
paying for the government maximum fees, not to us. Our fees is very, very low, and we also can help you. You can pay in the installment and loan also. We can help.
You take it in installments and loan, back loan.
Yes.
Okay. If somebody has done his as he's after specialization working in the field as medical officer, and if he wants to go through specialized channel for specialized course, will that be considered as medical officer? Will that be considered experience after considered experience or not?
अरे भैया आपका क्वेश्चन ही समझ में नहीं आया, आप क्या 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 पूछना चाह रहे हैं? हिंदी में बताओ, पूछना क्या चाह रहे हो आप?
मैं कहना चाहता हूँ कि अगर सर किसी ने एज पीजी भी किया है तो एज मेडिकल ऑफिसर यहाँ पे काम कर रहा है अपने फील्ड में, अपने ब्रांच में, तो वो कंसिडर की जाएगी अगर वो पोस्ट
की जाएगी। कितनी बार मैंने बोला, अगर आप वर्क कर रहे हो आफ्टर एनी फील्ड, वेदर यू आर इमरजेंसी मेडिसिन, इंटरनल मेडिसिन और सर्जरी, वॉट एवर, आपने किया, वो मेडिकल ऑफिसर वाला एक्सपीरियंस काउंट होगा आपका।
नहीं, I don't. My point is exactly, will that be considered as in specialized channel he wants to go?
No, you're not a specialist.
Not
You are
a GP.
No, you just a GP. You have to first, you are fighting to register yourself as a RMP in Australia,
Okay.
not as a specialist.
Okay, fine.
Sir, so for specialist, we have to redo residency again over there.
Yes, definitely.
Mhm. Okay.
How long is this residency extends?
3 to
3 or
6 years.
5 years?
3 to 6 years.
3 to 6 years. That he, in that period, he will be paid stipend.
Yes.
Okay.
Sir, even for GP training, it's 3 to 6 years.
Yes, around 4 years. Yes.
After AMC part 2, no?
Yes, part 2 or WBA, whatever. Once you got general registration, then around 4 years, 3 to 4 years. Okay.
Sir, if मेरी wife PhD economics है, she has almost 10 years experience from PhD. What is the scope of getting a job there for her?
I mean, teaching का job यहाँ पे इतना होता नहीं है. I mean, but she can do like postdoc or kind of things.
Pardon? What?
Postdoc she can work. Yeah.
Okay.
तौसीफ अरिंदम खत्म करें क्या? ये कोई लास्ट क्वेश्चन है, प्लीज पूछ लीजिए. आई एम जस्ट फिनिशिंग. यहाँ पे मेरे को एक बज गया है. 1:10.
Hello, sir.
Yes, Anand.
Sir, as you said, the course is it's for enough is 4 months, sir, 4 to 5 months.
Yes.
Then, sir, after completing AMC Part 1, your guidance will be until what stage of the getting jobs, sir?
We will provide you the coaching, the assistance for job and your registration, all those things we will cover.
And then document verification and CV, everything.
Yes, even our lecturer itself, जो आपको पढ़ाएगा वही आपको गाइडेंस करेगा. lecturer ही आपके आते यहाँ पर आएगा.
Sorry, sir. In English, sir, I don't know.
I mean, this is our faculty are also Indian.
Okay,
they
sir.
pass this exam, now they're practicing in Australia. They will also, guide you in all those things regarding job, your CV, cover letter, and all those things.
Okay. Thank you, sir.
Sir, hello. Sir, thank you, sir. One more question. Sir, I heard that we'll need references to get a job. References from doctors working in Australia to get a job after AMC 1. Is it true, sir? Because I don't know anybody in Australia.
It's not true, but you can make a lot of you can start active on LinkedIn, or
Okay, sir.
you will find a lot of Indian doctors, that's not a problem. This is not mandatory to have, any reference or something to find a job. If you have any, that's good. If you don't have, it's not mandatory.
Okay,
But
sir. Okay, thank you.
You are a IMG, right?
No, sir. No, sir. I'm from India. I did from.
I mean, in Australia, you are a IMG.
Okay, sir. Okay.
When you hear from the word, they were coming to office, IMG for us, right?
Okay, sir. Okay.
That at least you have a reference in your home country.
Yeah, that I can get, sir.
Even you can give our lecture. Myself is here. That's not a problem.
Okay,
Yeah.
okay, sir. Thank you so much, sir.
Okay, guys. Then you can please contact to our team for further information. So we are going to finish here, and I will basically we are going to conduct a one I think master class. Okay. So if anyone want to join that
Sir, one
class,
more question, sir.
yes. So you can join that master class, and you have a time to interact with our faculty also. Yes, Dheeraj.
Okay. Good evening, sir. Sir, I did my MBBS and I'm working in India.
Okay.
Sir, recently I have gone through a news in Economic Times newspaper. It shows that Indian medical graduates can now practice in USA, Canada, and Australia without writing an AMC, without
No, no, no,
writing
no,
for
no. I think
medical exam.
you haven't read
And
the.
it is shown
I
that
think.
the National Medical Commission.
अरे पहले सुनो
Hello?
यार, तुमने ओनली हेडिंग पढ़ी, तुमने पूरा पढ़ा ही नहीं आर्टिकल. हैव यू रीड द होल फुल आर्टिकल?
Yeah, I have. Yes, sir. Yes, sir. Yes, sir. I read that article.
So they did not mention basically you cannot write the exam.
Hello? Can you hear?
Writing exam is mandatory. Only the step 1 process epic verification no need. वो भी in future में, not now. So the process is the same as of now.
Okay.
There's no changes. But in future it may.
Sir, it is written that the National Medical Commission of India has received
अरे यार
the
इंडिया
World Federation for Medical Education
अरे भाई,
recognition status for 10 years.
here in India, anyone can write, the fake news. This is the main problem in India. You just pay some money, they will write anything, whatever you want.
Okay.
So this is not true. You have to go to, you want to practice in US, you have to go to US Assembly. Want to practice UK, you have to go to this PLAB or Australia AMC. There is no exemption for this. Okay. The only except the step 1 documentation process.
Yeah.
That only, they are going to exempt from that.
Okay. Thank you,
They
sir.
are just approving that Indian degree. That's it. It does not mean that you are no need to write the exam. Exam is mandatory.
Okay, sir.
Okay, thank you.
Sir, what about the master class, sir? When it will be held, sir?
We will let you know basically, what तौसीफ का डेट याद है क्या तौसीफ? 4th November को है भाई वो. Okay. So 4th November we have a master
Okay, sir.
class. So please you can join us and interact with our faculty also.
Sure, sir. Thank you so much.
Yeah, we will send you the email and WhatsApp also if you are interested.
Okay, sir. Thank you, sir.
Okay, guys, thank you so much. Line now is the 1:15 a.m. in Australia. So it's a little bit late for me. Okay, so Tawseef. Okay, thank you. Bye.
Bye.